South Africa's parliament is debating the National Health Insurance Bill, a plan for universal healthcare. Proponents say it will bring justice and equality to the healthcare system in the deeply unequal country. But critics say the plan is too ambitious and they doubt the government can do it honestly, citing repeated accusations of corruption in other public sector projects. VOAs Anita Powell has our report from Johannesburg.
When it comes to healthcare, not all South Africans are equal. According to the government, only 15% of South Africans have health insurance. The rest depend on the nation's overburdened public healthcare system. But the government is debating a bill to provide universal coverage, an ambitious plan that they've tested at several public hospitals already. Dr. Bandile Masuku, an official in the nation's most populous province, Gauteng, says a national health plan, in the spirit of Britain's NHS, is a moral necessity.
In a country like South Africa, we are a country of democracy that has to look after the vulnerable, and the universal health coverage is one way that we're going to do it.
Critics point to the government's track record of corruption and mismanagement and say the plan is too ambitious, too expensive, and too vague.
We've been at it for 10 years. We don't have enough clarity on how we want to do things now. To think that in the next 7 years you're suddenly going to miraculously have that clarity, it's just not a realistic proposal.
But for chronic care patients like Kanyisa Ntombini, anything is better than the current system. She's had numerous surgeries in public hospitals for her ailments, which include blindness, and says public hospitals need all the help they can get so the country can develop.
As a country, we will never be able to improve because we have this huge number of people who are unproductive and will forever be sick. So we need the NHI to implement it so that we have more funding in rural hospitals and township hospitals so that people's health can improve.
She says she's willing to subsidize the system.
I think quality healthcare, like food, like shelter, is something that everybody deserves to have, And for me, I would be more than willing to contribute to ensuring that everybody has a quality healthcare.
If the bill passes, the system will be implemented by 2026. By then, Ntombini will probably be working as an engineer, earning too much to qualify for public healthcare. And that, she says, is the point. This, she says, is for the next generation of South Africans. Anita Powell, VOA News, Pretoria.